Okay, so it's 8 o'clock. Welcome to the How to Find and Vet Evidence Mid-Pandemic webinar from Solutions Journalism Network. I'm Michelle Faust Raghavan. I'm here with Linda Shaw. We'll introduce ourselves a little bit more in just a moment. We'll give you a few more minutes, but as Linda just said, as you come in the chat, let's try to use the chat to all participants so everyone is involved in the larger conversation. The Q&A function, we're gonna just ask you to not use so that everyone can see what the questions are and everyone can see what those answers are if those are put in there. We've got a few of our other colleagues here answering your questions. Sarah Gustavus and Leah is here as well, helping to answer your questions and make sure that we don't miss anything and that we can make this the best and most user-friendly to you. Again, my name is Michelle Faust Raghavan. I'm the West Coast Region Manager for the Solutions Journalism Network, and that means I work with most of the newsrooms on the West Coast to make sure that they're producing great solutions journalism, and evidence is a big part of that. And Linda, I'll let you introduce yourself.
Yeah, good morning. I'm Linda Shaw. I'm the previously was a West Coast manager for Solutions Journalism Network. Now am editorial director and manage our Renewing Democracy program. Also a longtime reporter and editor at the Seattle Times, where I first encountered solutions journalism, working on a solutions-focused project called Education Lab.
And so we're really glad that you came here today. Let's first get started by talking about what is solutions journalism and what is it that we're talking about when we're talking about using the evidence for solutions journalism. Solutions journalism is the rigorous evidence-based reporting on responses to social problems. So we have the word solutions in there, but really we're talking about responses. Some of those things are really great responses with great evidence that they're working, and maybe the evidence is showing something else, but we're going to talk about that a little bit more today. What is it that every solution story should have? We talk about it has a response and how it happened. We talk about that, how done it, how did they do something, not isn't this person great, they did something nice. No, it's really how did they do it and make it work for lots of folks. We want to have evidence of results, and we want to look at how effective it is. And so we're going to do that to get a sense of what's going on, and that's what we're going to be talking about, how to make sure that that evidence is good today. We want to have some insights to not just have inspiration, but to help others respond too, so people can actually learn from this story that's being written about a response to a social issue. And we want to have some of those limitations. We are journalists, after all. We want to look at what's working, and you know what? There's always something that's not working. Often that's funding. Sometimes it can be other issues, like it works for just one group of people and not as well for others. But those are things that we want to include in our reporting. So, any questions so far? Make sure you put those questions in the chat. Make sure you make that to everyone so everyone can see what those questions are. Anything, Linda, Sarah, Leah?
No, I'm guessing that maybe a lot of folks on the call didn't need that quick review, that are well familiar with solutions journalism, and that's fine. We just wanted to do a quick review for those of you who might be newer to what solutions journalism is all about.
Excellent.
So I think we're ready to dig into the evidence. So we wanted to do this webinar now because obviously, during a pandemic like this, a lot of the responses that you're going to find yourself wanting to report on are rather new. And how do you find the evidence for something that's rather new? Often when we talk about solutions journalism, it's when you have lots of opportunities to do responses that are further down the line, where there has been a chance for kind of robust evidence to emerge. But it doesn't mean you can't do solutions journalism when responses are newer. And that's what we're really going to focus on today. So where do you look for that evidence? You know, it's probably obvious to say you look for that evidence the same way you would look for evidence for any story. Well, this is just a list of, you know, all the places you can look for evidence, some of which actually we've seen examples already that solution stories have been able to find. So obviously you're looking for data, by the people involved, data from county, city, researchers, nonprofits, You can look for data from similar, if you're writing about one response, you can look at for data from a similar effort that's underway. Academic studies are always good, and sometimes for newer efforts, again, you're looking for academic studies on something similar, not exactly what you're writing about. Experts with relevant expertise, on-the-ground interviews, and don't forget the people that are affected, right? I mean, it's the same kind of evidence for any story you do when you're looking to show a problem as well as a solution. But when you're looking for new responses, the ones in orange are the ones you're probably going to focus on the most, right? You might have some data, initial data collected by the people involved. There might be some of that. You're not as likely to find, really robust data collected by government agencies yet, or even nonprofits. But there might be similar efforts that have some data you can use, and we'll show you some examples of that later on. And of course, there are opportunities to talk with experts with relevant expertise, on-the-ground interviews, and people affected. So we wanted to jump into some examples. And again, just to stress what many of you know, solutions journalism isn't about writing. It's about writing about responses to social problems, and not about finding the perfect solution. What you're examining is how people are trying to fix problems with a critical eye. So that means that the evidence doesn't have to be perfect, right? And that's good to keep in mind when you're looking at, writing about initial responses during a pandemic. So here's an example of how you can use initial evidence. This is a story from the New York Times about mobile testing. This was about a month ago, which seems like 5 years ago, when this was just starting up in Seattle. And there wasn't a lot of evidence then, but there was a little. And the reporter collected it from the people involved at that point, just showing that it was much faster to do this mobile testing, that this was a promising practice that could speed up the number of tests that a city could do. They didn't quite quantify how long it would take in a hospital, just having a doctor stating it would take quite a long time. But mobile testing, they can test an individual in 5 minutes, and they were able to do 40 to 50 patients within a 2-hour block. So that's an example of how to use initial evidence. On the ground interviews, anecdotal evidence. This story from the Christian Science Monitor is talking about how teens are coping with a pandemic and turning to social media. And don't just talk to experts. Don't just talk to experts about that, but talk to the teens themselves. And that can be one piece of your evidence. But with anecdotal evidence, obviously, to make it a robust solution story, you don't use that just by itself, right? You don't want that just to be a story about these two girls and how they're using social media in a good way. That isn't, that just tells their particular story, but doesn't really help see whether this is a promising practice that's worth other people considering as well, other teens considering as well. So they back that up with by both talking to experts and by bringing in this Pew Research poll, which makes it clear that it's not just these two girls, that other teens also find social media helps them feel more connected. We talked about talking with experts with relative experience. I thought this reporter from the LA Times did this particularly well. This is a story about 4 young people that focuses on 4 young people in Los Angeles that have created sort of a COVID family. They didn't want to all be isolated in their individual apartments, so they sort of made a pact that they would see each other and see each other only. By itself, it could be a nice, feel-good story in a way, but the reporter went further than that. The reporter turned it into a solution story by examining, is that really a good idea? What's the evidence that it is or it isn't? And to do that, they went to folks who knew something, not just doctors in general, but doctors with experience in epidemiology, doctors with experience in public health, who did underscore, yeah, this can work. This is not a terrible idea. There's already opportunities to compare one place to another. This story from the Washington Post did a good job of that. This is looking at what Ohio did, how early it closed down, and compared to, at this point of this story, compared to what was happening in 3 comparably sized states, looking at both the number of COVID cases and the number of deaths in those states, and found that Ohio, at least at that point, was seeing some benefits from that. The idea of early intervention seemed to be working. And you can compare one time to another. This is a very interesting story about a text messaging service in Alberta to help folks that experience anxiety and depression during the pandemic. And the evidence that they used in this story was looking at what happened when they used that same service during a big wildfire about 4 years ago, and used the evidence from that experience to examine whether this is a good idea for doing right now. And the evidence then showed, yes, it was a help. It was a help during the wildfire. So they're trying it again. And many of you maybe are familiar with this graph, comparing now way back to 1918 during the last big pandemic in the United States, showing the difference between what happened in St. Louis, which practiced social distancing quite extensively, and Philadelphia, which did not. And this, I couldn't find a pandemic example for this, but just one other tip. When you're looking for data, if you can't get the data you want, a really good question to ask is, well, what data do you have? Because often that'll turn up some information that will be useful that you didn't know about. This was true in this story. This story was from the Seattle Times, looking at a district that had succeeded in diversifying its gifted programs and its advanced programs at high school. The reporter really wanted to know, okay, how many students by race, after taking those classes were passing AP tests? Couldn't get that. I forget the reason. I think it had to do with the College Board not releasing information by student. But when she asked, what can you get? The district said, well, we can tell you how many students are passing those classes. So that ended up being a useful piece of evidence. And before we round up this portion, just wanted to let you know we put together sort of a collection of databases, one-stop shop to start answering or examining the question, are people of color hit harder by COVID-19 in your state or city? Tomorrow in our webinar with Matt Kaufman and Cheryl Phillips, Matt will talk about this in depth, but just wanted you to know it's available from all the jurisdictions, I think more than 50 now, that are breaking down that information by race.
And we have a question already in there that asks, which other historic circumstances, if any, could we look at for examples of impact of a response during a major shutdown crisis that reflect COVID-19? Now, I think really where you'd want to look, it's going to be dependent on where you are and the type of responses that you're thinking about. But you gave that example, Linda, of during wildfires. I know that some of the newsrooms I'm talking to are interested in looking at like the wildfires, especially the catastrophic wildfires last year in California, and how folks were, they had to be displaced. Kids were not able to go to school. They were not able to have graduations. That's very similar to now. Some people are looking at responses on things that happened during Katrina. Yes, it's a different type of crisis, but we can see that there are some similarities. So you have to make that decision response by response, whether or not there is a good similarity. But I would say that there are plenty of responses from other crises that can look similar.
Yeah, and I would just add, just like when you're trying to compare one place to another, you want to be transparent with your audience about what's similar and what's not, why you're looking at that particular response. These are the ways that are similar. These are the ways that it might not be.
And we see that, we can look at what happened in Ebola in certain African countries. There was a great response. First, a huge pandemic, a big problem, crisis, but there was a response, scientific responses and other social responses, and they were able to get a lot of the things done. I also noticed that there may have been a question in the question box, which we are asking. Please do put your questions in the chat. Leah, are you able to see that question?
Yeah, we had another question from a participant who wants to hear more about the differences between, if there are any differences, between solutions journalism and investigative journalism.
I'll let Linda take that.
Yeah, solutions journalism is, we often call it investigative reporting into what's going right as opposed to what's going wrong, right? So you use the tools of investigative reporting to examine how people are responding to social problems. So yeah, I consider it an arm of investigative reporting, an arm of watchdog journalism. Does that
absolutely help? I hope so.
Yeah.
I will say that
I can't get an answer, so put it in the chat.
Yeah, and I will say that whenever I've done investigations in the past, I've always included a solution, because a lot of the times I was a healthcare reporter for many years, and a lot of times I was talking about, okay, pandemics, you know, we're talking about major issues with health, we're talking about healthcare disparities, but I always look at what is some response, something that gives hope. And it's like, we like to say, like, this isn't hope journalism, but it can provide some hope, but with teeth, because we're giving you data to back up whether or not this is actually working. And we're also giving you the caveats. So we actually are looking at it from the whole picture and not just, isn't this nice? It looks like there's one more question in there.
Yeah, it's about qualitative evidence. So yeah, they're qualitative evidence. Some of the evidence that we mentioned above is qualitative evidence, right? Talking to experts is qualitative evidence, right? Looking at past polls of teenagers is a kind of qualitative evidence. Talking to people that the response is affecting is a kind of qualitative evidence. I would say that when you're dealing with qualitative evidence, you know, you, like any story, you want to assess how strong it is, how convincing it is. You're usually not going to stick with just one piece of qualitative evidence. You're going to want several, which is what you saw in that story about teens and social media.
We have another question. In contexts like Colombia, interviews will be key because there's not much available data or technical skills for analyzing it. What advice would you give for interviews as evidence, and are there any recommendations? I can tell you that I've seen journalists where they were not able to get quantitative evidence, that they've done both scientific and non-scientific surveys to try to add more to that. So for the example that I'm giving right now, I worked with a young reporter in the Coachella Valley in California who wanted to talk about people in that rural setting who were homeless and some of their health issues. What she did was she interviewed lots of people. She was able to use some of that interview for her story, to like use those quotes and have that, but also there was some quantitative from that. Of course, you want to make that plain. I gathered this data. It's non-scientific. This is what I was able to do. But that person is also working with professors to do further research, to do some scientific work. So it's really a matter of how can you make that happen. And I'd be happy to put in our follow-up email some examples of that particular project. So I don't see any new questions, and I'm going to move on in the interest of time. And so let's talk about vetting the evidence that you get. We've got some ideas of where you can get some evidence, but you always want to ask these questions of your evidence. Who gathered that evidence? Who paid for it? And is there more than one source? Think about your evidence almost as another source that you're interviewing. You're always going to do some background check of who you're interviewing, and you know, do they have a right to speak about this? Do they know? What do they know? What is their background? We also want to talk about who's paying for it. What is the, you know, who's gaining from this? The cui bono, you know, and why are they involved in telling you what they're saying? You may still talk to them, but you want to make that very evident and clear in your story. And then, of course, very rarely are you going to do a story with a single source. You want to see, are there other sources of data to back that up? Maybe there isn't, maybe there is, but do your best and make sure that you are very clear with that. And then before you look at a scientific research report, so we're going to talk about just scientific journals for just a moment. You want to, first thing I want to say is I've seen a lot of reporting in the past, and I believe you guys are here because you don't want to do this kind of thing, but there have been some reports in the past that were just based on abstracts of articles. Make sure you read the entire article so that you can put the entire context, because sometimes the abstract can be a little bit misleading. So this is quite important here. If you are not able to, first you can go ahead and buy that if you're able to, if your newsroom is able to, but also write the author. Often authors are able to send you that journal article directly because you're a journalist and provide it to you for free. So always something to try. Who funded that research? Again, the cui bono, who is trying to gain from this? This is something that you want to definitely ask, look and see. In the article itself, there will be some work about, are there any conflicts of interest here? So you can see that, and then do a little bit of investigating of who's paying for this. Also, where did the study come from? You want to think about the journal. How respected is the journal? Where is it coming from? There are some journals out there that exist just to fool journalists. So these are things that we want to be aware of. Also the researcher, is this a researcher who has a lot of body of research in this area? Are they working with other researchers that are respected in this area? So these are things to consider when you're doing scientific reporting from journal articles. Ask yourself, is this peer reviewed? A lot of reports right now around COVID are not peer reviewed. People are just kind of putting up their white papers and making them free on the internet. That is not research you want to be reporting on right away, because we just don't know yet about whether or not that's going to be upheld by the peer review process. Does it build on existing research? Are you able to look at other research that back it up to make sure that that is something that is usable? Also, we want to look at sample size. If you're taking a large sample size of humans that have been studied doing a certain thing, especially when it comes to health, then you've got some better evidence. But if you've got a very small sample size, not quite as good of an evidence. Is there a control group, and how are the samples chosen? All of those things are going to go into your reporting. Also, if you're talking about an experiment for, let's say, a medical treatment or drug, an animal experiment, an experiment that's giving some evidence in mice may not hold up by the time they get to human trials. It may never get to human trials, so be very careful of that. So right now, when it comes to COVID, I would say with the journal articles, beware, ask all of those questions, but I would say let's be a little bit careful about using scientific journal articles on COVID right now. That doesn't mean I say don't use scientific journal articles. Probably the most of my reporting has come out of that, but when people read these, sometimes they misread them, or they don't read them at all, like I had mentioned, and often that new study that doesn't have a whole lot of things backed up, they're very exciting to report upon, but there's a lot of things in news that is wrong. And so I gave you this example here. A lot of studies that you read in the news are wrong, and this could be one of them. It's very tempting, but beware, and especially around COVID right now, there's been some initial reporting about some treatments that later turned out that there was very little evidence of this being held up. So let's also talk about data. You got a great data set, and now you need to think, okay, how am I going to interrogate this data? How am I going to see whether or not I can use it, and how I'm going to use it? So is this the best available data? That's the first question. What is it tracking? What is it not tracking? These are things to consider. You want to, look really at what exactly is being measured, because sometimes we can be a little bit confused about what's being measured. If you look at like a survey of a hospital, and that hospital has great results by everyone who's gone to that hospital, what are the people actually tracking? It's not necessarily health results. A survey is like, I feel good about the way I was treated, but then later on I had a secondary effect from that treatment. So you want to think about health outcomes in a different way that you might look at satisfaction surveys. So those are the types of things you want to consider. Also, is this complete data? How much do you have? Are you able to get more, a longer period of time? Right now with the COVID stuff, it's not going to be a large period of time, so that's something to consider. Be clear about that in your reporting. How is it collected? By whom? Have you read the data dictionary? So especially in the United States, and I believe that this is pretty international, whoever you're able to get that data set from, like if I were to get it from the state of California, where I've reported and lived for some time, I would get that data dictionary, read it through. Large data sets often will have weird codes to mark what those columns mean, and it is impossible to decipher or tricky to decipher. So you really want to read that data dictionary, understand, and you know what? If I didn't understand that, there was a person who wrote that data dictionary, and I may be interviewing them to see if I can get it clear. And then you could interview the collectors. How did you do this? Are there different ways that it was collected? So example, for health data in the state of California, every county is collecting that data maybe a little bit differently. So you want to make sure, how much standardization is there? These are all things that you want to know when you're interrogating your data. Also, you want to make sure that is clean. Consider all data sets dirty. That people who enter that data, they make typos, they make errors. There can be some anomalies, and some things might look too good to be true or disastrous. Figure out what that is and ask those questions. Ask it of the data, ask it of the people who collected it. What are the questions that you want answered? Before you look at a data set, before you get into that spreadsheet that is just mind-blowing and causes you lots and lots of stress. I've done that before. Write down a list of questions, just like you would before you go into an interview. And what is it that you want to know from that data? And then look for that specific answer in the data. Once you've got that answer, you can go to the next question and try to get that next thing answered. And that'll kind of give you more of a sense of, are you moving in the right direction? And do you need a little bit more help from a certain person who might be able to know a little bit more about that? And think about the different factors that could be causing different types of results. Talk to critics, people who would say, you know, I don't believe in this data, or I don't believe in this process. Talk to experts, people who can say, yeah, this data lines up with a study that I did or other studies that I really respect. Those people can add some qualitative evidence to your quantitative evidence or give you more quantitative evidence. So these are the things you want to do. Also, people involved in a response, in a solutions reporting response. You did this great thing, you got decent data, but was it worth the time? Was it worth the expense? What else can you say to this? So this is going to give you a little bit more of that qualitative data to give you that larger picture for your story. And you might be asking, so how much evidence do I actually really need? Okay, that's fine. The real question is, what is it that you're trying to get out of this as a reporter? What's going to satisfy you? What's going to satisfy your editor? The reason I say this is that really you've got to use your good news judgment. You're the reporter here, and you'll have a sense. But these are the types of questions that you want to ask first. If you're satisfied by those answers, then you probably have enough data. You also want to be clear. Maybe there'll be more data later. So in an early stage, like a COVID story, you don't have a lot of evidence. You can still write a good story. You want to be very clear about what you have and what you don't have. But then a year from now, go back. 6 months from now, go back. Do you have new data? Do you have more? Especially in the United States, there are usually legal reasons that people have to report either to the federal government or to the state government. This is the case in different countries around the world, but you want to look and see, where is that data now? You might be able to circle back on that story where you only had some initial data. Any questions? Don't be shy. I'm going to give people a little bit of time to type those questions up into the chat. Anything you want to add for that section, Linda?
Yeah, I was just thinking, you know, that's a lot of good advice for how to interrogate evidence in general, not just data, right? Because, yeah, you know, you want to, you know, it's just following the rules of good journalism, right? You want to get very many different perspectives, talk to critics as well as people involved to get a full picture, to, you know, interrogate your evidence, not just the data, to see if this response is worth writing about, if it's robust enough.
So it looks like we've got one question from Andres that says, for journalists who are doing reporting about solutions on a daily basis without much time, mainly just positive things without much evidence, what system and or process would you recommend for turning them into good solutions journalism stories? I'm gonna let you take that one, Linda.
Yeah, I mean, I would ask all these questions, right? So do what you can to talk with, think about who would be an expert that would be able to add some depth to what you're writing about, that would have an independent perspective on whether it's worth doing or not. Ask the people involved what numbers they have, to see if that could help. And also, I would just say, very key is asking people about, just to address the questions about the limitations of the response. That's key to any good solution story. And even if you can't collect a lot of data at the outset, even if you're just asking those questions, if you're not getting answers to those questions, at least raising them in the story. Like, I'm trying to think of an example off the top of my head, but well, in the example of the 4 people living together as a COVID family in Los Angeles, the reporter asked that question of experts, right? Is this a good idea? Would this really work? What would take for it to make it work? What would make it fall down? Obviously, you have to have a high level of trust, right? If one person sneaks out and sees a bunch of friends and then comes back to the house, that's not going to work anymore. So I would say you'd have to think about what those limitations could be and explore them in the story. And I think you can do that pretty quickly. You can at least list them. Like, what we don't know now is how well this is going to work in the future, or how this is going to work with this group of people, or whether that would translate, to more than just this one situation. So yeah, I think there are ways to do it. There's a lot of examples in our tracker, and we can send you some of those in the follow-up email as well about how to do solutions journalism quickly.
So let's talk about how we can use the evidence that you're gathering and that you're interrogating. So once you've got the data, you've got the answers you're looking for, and you've got some evidence, you want to make sure, we've said this again and again, and I'm going to say it one more time, do not overclaim, do not predict the future. You have one data set that tells you one thing, make it clear the things that might be relevant to it that we don't know. So we want to kind of get that sense. Also, try to paint as full of a landscape, put as much nuance in your story as possible, because again, these are not just feel-good stories. These are real looks at things that may be working and how they are working. And maybe they're working for just a certain group of people, or a certain portion of the problem. All of that should be in the story to make it clear. And make sure that your story is about the idea behind the program. So maybe you're using an illustration of, here's a great response, here's what somebody's doing. You're using one particular example, but make sure that it's got all that how is it coming together? How is that idea? And not so much, aren't these people great that they're doing this thing? Also, always remembering those limitations. There's always something that's not quite there. Ask the people who are doing the program. I have not personally in my reporting had problems with people saying, hey, we wish we had more money, we wish we had more people, we wish we could reach a larger portion of the population. Those limitations will come out in your reporting, and the people who are benefiting will also say, hey, this is great, but it only helps me the first week of the month. It doesn't help me out through the whole of the month. Those are the types of things you want to think about. And then think about data visualizations. Are there graphs or other ways that you can present the data to make it really effective to your audience so that they can really bring it into their mind and think about it, and have a better understanding of what you're trying to paint.
So here's some examples of how this is done in recent stories that are, solution stories about the coronavirus in one way or another. Don't overstate. The Ohio story that we've mentioned before from the Washington Post, very, very up high, says, maybe realizing the benefits of early intervention. So that's a good example of not overstating. They're not saying Ohio got it right. They're saying Ohio maybe got it right. And that's really important in when you're reporting on early responses, to just be very transparent about what we know and what we don't know. And this is a second example from the same story. It acknowledges further down in the story that this doesn't mean Ohio is out of the woods. We've talked about clearly stating limitations. I mean, this is sort of what helps distinguish solutions journalism from sort of happy news, from just kind of good news, right? Looking at as we said before, looking at those limitations. And in the story about text messaging, in Alberta that we talked about before, clearly states in that story, this is not a cure-all. This isn't, you just send people a text message and their anxiety and depression is gone. It's one piece of a care plan, or can be used alongside other tools. It's a tool, it's one tool. And stating that very clearly, I think strengthens stories and strengthens solution stories. We're seeing that a lot more now. And actually, Leah Todd, who's also on this call, pointed this out to me, that more and more commentators, this was was pointed out by in a journalism professor who teaches journalism history, that they're seeing a trend of newspapers and news organizations being much more transparent about what they don't know, as well as what they do know. And this is an example from the Los Angeles Times. As you can see, this was early on, it was a couple weeks ago, but you could still write it today, right? And very clearly stating to the audience, there's a lot we don't know, and this might change, but even by the time you read it. We talk about focusing an idea with the effort as an example. This is something we often talk about in solutions journalism as a way to make sure that your stories don't even sound like advocacy, but they're also important when you're writing about early responses that are just emerging. I think the Ohio story is also an example of that. They don't write about Ohio as the best thing is sliced bread. They write about Ohio as an example of what early intervention might be able to do or might not be able to do.
And again, going back to that transparency of what you know and what you don't know, there's a story here about Utah and New Mexico. They're leading the region in COVID-19 testing, and here's how they've done it. So we've got a lot of information about how they're leading in their region and the reasons why, but there are things that we don't know about the longer term. This was something that was done in April. There's also some ways that we don't know about some of their infrastructure. Like, they were able to benefit for infrastructure that existed in those states, but we don't know how much of that played a role. And there are just many other factors around the size of the population that could be a factor. These are smaller population states than many other places in the country. So all of those things may be playing a part, and they're just very transparent about that. Also, when we go back to data viz, this story has so much data visualization. In fact, this story was both a radio story and a web story. In the radio, there was very little evidence. They did have some evidence. It did count as a solution story, but where they really beefed that up was in the data visualization in their write-up on the web. There are other ways to do it. You can put more evidence in broadcast. It is a little bit tricky, especially in radio, where you don't have that ability. For something, for example, on a television broadcast, you might want to be using some of those data visualizations, because you can put that up on the screen and talk around it, and it does a lot of that heavy lifting for you. Any questions?
Well, we have Christine in the chat talking about how she addressed limitations, or talked about the evidence that what wasn't known yet in writing about Portugal's temporary granting of residency status to asylum seekers. Yeah, that's the kind of stuff we're talking about. I assume you're offering that as an example of how to address what you don't know as well as what you know. Is that right, Christine?
Oh, yes. There's a question here about the data visualizations and tools that you can use. There are many. One that is very popular that I will mention is Tableau, but there are very many others, and I could probably give some examples in our follow-up email of some other ones that are also used. Tableau is probably the more popular one that I know that a lot of journalists use. There are other journalists that are not quite as fans of this. I have a free version of Tableau, and I believe that there is also a more expensive version.
Yeah, I would say, using data visualization, or just in print publications, just charts, is a good way to present the evidence in a solution story. That's hard to do sometimes with a lot of words. So I think it's really good to look at presenting the evidence if you have data in that way.
And again, I'm going to mention that need to follow up for those stories, especially around COVID, because right now we're going to have some emerging solutions that'll be full solution stories. Maybe you'll do a story where you really just don't have almost any evidence and it's not going to hit those 4 pillars, but follow up. There will be a way to be able to look back at it and say, you know, this is a solution that really worked, or you know what, after we got more evidence, this is a solution that didn't actually work, and have that instructive failure of how it may have worked, or, you know, what do people think? Where did it go wrong? We can also learn from those things. And then sometimes there are solutions that are working really well. Something happens, they hit a pivot point, things change. That does not mean that you don't do that story. You want to tell the story of how things were working well. We've got the evidence that it was, but then things changed by the next year. What was that happened? That's going to be really interesting and instructive to your audience.
Yeah, and even in the moment, you know, just be creative again about thinking about who could help us understand whether this response is newsworthy, is worth looking at, is promising. Who would know that? Would it be experts? Would it be people on the ground? Would it be some combination of that? I think you can do a lot in the moment as well. And again, you know, just being clear about what you know and what you don't know in the moment, because there's going to be a lot that you don't know. But that can help elevate the story and really give it more heft and power than if you just wrote about one anecdote about what a few people were doing or about what one organization is doing.
Please do put your questions in the chat. We're here to answer your questions. We're actually running pretty far ahead of time, which is great. But we definitely want to make sure that this is the most useful webinar for you. So do let us know if there's other things that you need to know. Also know that we will be doing another webinar on Friday at the same time on Friday. Depending on where you are in the world, that'll be 8 a.m. Pacific time in the US. But yeah, join us on Friday. We'll have a panel. I'll be interviewing data experts and somebody who would talk about scientific research and how that works. And we'll be answering all of your questions there. So it looks like there's another question.
Yeah, well, Catherine we're again talking about her story about Portugal and temporary granting residence status to asylum seekers. I was just kind of opening up to the group. What do you think? Who else might have some evidence that could help? Who else might she want to talk to? She can't get the public health agencies have applauded the move, but evidence isn't available about the health data related to migrants. Who might she talk to? What kind of evidence might she look for beyond the health agencies? Are there some ideas from your fellow panelists out there? Michelle, what would you say as a former health reporter?
Yeah, I mean, the first place that I would go, and it sounds like that's something that Catherine already did based on the last comment, the first place that I would go would be to those migrants themselves, because whether or not they're having good health outcomes, they're going to be able to self-report how they feel about their health outcomes, how they're feeling about their mental health, and they'll be able to have those conversations with you and talking to as many people as possible. Again, going back to that example that I gave you around homeless people in the state of California and some of the more rural areas, we don't have a lot of data about health outcomes. This is a hard to reach group. This was not a scientific survey that was done, but the journalist herself was able to pull some data because she talked to so many people. She said, of the people that I surveyed, this is what I found. That was a big lift, but it was interesting, and it really came from the folks and not from some agency that's not necessarily speaking from the people themselves. So these are details that I would add to that. It looks like we've got a question about what to do if you're being stonewalled by a government agency that has the data, but that is not willing to release that to you.
Well, that's a question for not just early response solution stories, but any kind of stories, investigative stories, you know. You know, you have to, the public, you know, freedom of information laws in your state or in your country really determine what you can fight for and how. But I would just say, you know, one good tip that has seemed to serve me well is to have a conversation first with the agency. Try to get a hold of the people that collect and keep the data. Help them understand what you're looking for and why. and before you go through the formal process, whatever it is, wherever you are, to try to get that data. You know, if you've built up those relationships before an emergency, that obviously helps as well. And sometimes that helps them relax a little bit, and you get the data that you want sooner. And you don't get stonewalled as much. Not to say you won't get stonewalled. I've been stonewalled plenty of times. Then you can try to think about who else might have the data that you might be able to get it from if you can't get it from the agency. If they shared it with another public agency that also is required to release that information to the public. What else, Michelle?
Well, I can give you an example. You're giving great examples, Linda, and having that kind conversation, but sometimes you need to pull out the bigger guns. Let's not talk about the legal things that your news organization can do, but I once had a colleague and a friend at the Rochester Democrat and Chronicle who got almost a phone, this is an education reporter, got almost a phone book size paid document of all the different documents, and it was all blacked out, every single page, every single word, with just a few words unredacted, and it was unusable. And so what they did was they printed a photo of that and put that in the newspaper and said, we're trying to do a story about such and such and such and such, but this is what the health or the education agency was willing to provide for us. This was unusable, and it actually worked. It shamed them publicly in such of a way that they ended up getting, I don't believe that they got everything that they were looking for, but they were able to get a lot more information that they were able to use in those stories. So, you know, that is one way you could go. Your news outlet may or may not feel comfortable with that, but sometimes you got to pull out the big guns.
Yeah, and again, it's also time for that question. You know, I've often asked folks, when I actually can get to the people who keep and collect the data, it doesn't work as well with the public information officers, but like, well, why are you balking at this? What do you know, what are the concerns here? And then you can maybe think creatively about, okay, well, I don't really need that, but I want this, you know, or think of a different way that they could give you the data in a way that addresses their concerns. So, yeah. What other, I'm curious, are other of you working on stories that you're struggling to think of where to find or look for data or assess data? Please put those in the chat and we can discuss those as well. What are you working on, or what do you hope to work on? I've just been struck by, while people are talking, I'll just say I've been struck by, you know, how many great solution stories we've already seen just in this last month or so. There've been, you know, we put some examples in this presentation, and you will get the slides afterward. But if you also go to our story tracker, Solutions Journalism has a story tracker with about 9,000 solution stories. We have a special section just for solution stories about COVID-19 and coronavirus, and there's just a lot of great stories and more every day that are being written about good responses, robust responses, interesting responses that are newsworthy, frankly, about how people are making progress.
Do you please put any of your questions in the chat, or if there's a story that you're working on that you're kind of struggling with, please do put some information in there. We'd be happy to help you with that. And then if you're a little bit shy and you don't do it today, I do highly recommend that you do it today so we can have that conversation together. But if you don't and you come up with some questions later, you can always email me or you can email Linda. Solutions Journalism Network has region managers across the US and almost everywhere in the world. So we will be willing to help you out with those questions as they come forward. So do not be shy to ask your questions, please, here, or if they come up later, email us directly.
And I would just add, kind of in summary, you know, to remember that, you know, reporting on early responses is sort of about reporting about solutions in general. You know, you don't have to find the best solution. You don't have to find the only solution. I remember feeling very nervous about that, and when I was starting to do solutions reporting, and realize that's not what this is about. This is about writing with rigor about what's going right, not just about what's going wrong, and that what you're doing is examining how people are trying to fix things in a way that provides information and insights that help your community. That's what this reporting is about. And you can do that with early responses as well as things that have more robust evidence over time. So I wouldn't hesitate doing solutions journalism this time. I think this is a great time to be doing solutions journalism, especially as when we see institutions like the CDC even recommending that the news is, can be so disturbing that people limit their news diet. This is a way to write about the problems that we're facing in a way that has some hope, right? Not false hope, not to make people, not with the purpose of making people feel good, but not ignoring the fact that there are a lot of folks out there working on and trying to solve these problems, and making sure that we tell those stories as well as everything that's going wrong.
We have a question in the chat from Laura, and Laura says that COVID long-term care angle we're struggling to figure out is how to get at how many non-COVID-19 injuries are happening in nursing homes, thinking bed sores, dehydration, and what's being done to ease them, given that there's many no longer have access to homes to check on loved ones, and it's really hard to determine, and how, I guess we figure it must be happening. You know what? This is something that's very near and dear to my heart. We need to do, my perspective, my opinion, not Solutions Journalism Network, although I think many of my colleagues would agree, we need to be doing a lot more reporting on what's going on with our elders and their health, because I just would like to see a lot more of that reporting, and especially what's going right, because there is some reporting of some of the tragedies of what's happening with our elders. Around the long-term care facilities, they are required to submit certain things for, if they're getting Medicare in your state and Medicaid dollars in your state, there are certain things that they have to be reporting. You probably are not going to be able to get that data until the end of the year, but I would not leave that story alone. I would be looking into that, because you're probably right, especially because people are not being able to be checked on quite as often around COVID because there's concern about close contact of folks. These are things that I would definitely follow up on. This is a great story, but these are things that are required to be reported. I know that a lot of reporters have talked to me about having a hard time finding numbers around COVID cases in long-term care facilities. Do not leave that alone, but because some things will be coming up later. In the shorter term, make as many calls, knock on as many doors, talk to families as much as you can. But this might be a story that you just kind of hold on to your back pocket until you're able to get what you need to be able to report on it.
Yeah, that's true. All that's true. And I would also wonder, if these are really serious injuries, would the firefighters in the community know, right? Are they going to this, to an institution more often? Are they finding themselves anecdotally, that there are a lot more calls for falls or people having to go to the hospital for non-COVID related reasons? Maybe there's social workers or other folks that are in and out of retirement homes that also are noticing differences. I look through, all the way around who interacts with the folks there that might know, that are independent, and might have some perspective on what's happening.
So we have a question from Andres, accepted, but just jumped. There are some change makers working for helping others in slums and poor communities. I want to do solution stories about them because from several conversations, I feel that they're in a poverty trap, but I haven't found any studies about this. How do I frame it better in a solutions study and not as a PhD research? I'm going to let Linda start, and I've got some ideas as well.
Okay, sorry, I was reading the last question.
Okay, then I'll get started.
Why don't you start with that one?
This is from Andres, who's just talking about some solutions around helping people who are living in poverty. And we know in the United States, and we've seen this in many other places in the world, I'm more familiar with what's happening in India, who is most affected by COVID-19. There are people who don't have the privilege of social distancing because they don't have as much space. They've got a lot of people in a smaller space because they are the essential workers that have to go and clean whatever to make our society run. So yeah, these are people who are more affected. But yeah, if you're working with change makers and people who are doing some work around this, I would get started by talking to them. I would also look and see, there are often are researchers who have worked in these communities before. They may have some ideas and some sourcing and some contacts that might happen for you. This is probably somewhere, especially when you talk about communities that are most at risk for COVID, whether that be around poverty, around race, immigration status, all of that, especially in the United States, but this is also the case around the world. Those folks, often there isn't as much data around these communities as we might like. That's where you're gonna have to really lean in, gather your own data, get as much qualitative evidence as you possibly can. When you're working without quantitative and only qualitative evidence, you're really going to need to make sure that you're talking to a lot of people and that you've got a really good sense of how things are working from as many people as possible. This is going to be a challenge, but I think it's a great story and I think you should go after it.
Yeah, and Andreas, I would talk with the change makers as well and ask that question. We often recommend asking the question, where did this idea come from? This effort that you wanted, that you're working on here, where did that idea come from? Often they've heard about something that's worked somewhere else and they want to implement it in a new place. And then you can look back to the place where it was tried before and see what happened. And you can look for your evidence there. And you can find that a lot faster than if you're trying to do a PhD thesis and collect all that data on your own, right? And often there are similar, you could also, even if they don't know of something, you could look for similar efforts that have been done elsewhere and see what, and evaluate what happened in those places. That's the best, that's where I would start.
Yeah, I think that's really good advice, Linda. I'm gonna just talk a little bit about what you guys can expect for on Friday. If you do join us, I do hope you will. And then if we don't see any more questions, I think we'll go ahead and wrap it up. So we'll just give you a couple more moments. But I want to remind you that on Friday, May 1st, we'll have a panel at the same time, starting at 8 a.m. Pacific or whatever it is in your region of the world. And we're going to be talking to data experts. We've got 2 data experts. Matt Kaufman from SJN will be talking about the work that he's done to get look at the disparities in healthcare around the U.S. So we'll be able to talk about that. We'll also talk a little bit more with someone who's more expert than me, actually somebody who trained me about interrogating that data. And we'll also be talking to an expert in looking at scientific research and who teaches that for a living. So please do come. We'll be doing that pretty a little bit more free flowing, and we would love to see you there.